I'm Mike Barrett. I'm the CEO for the South West LHIN. Glad that everyone could come this morning. It's also nice to see so many familiar faces. Walking around the room today, so many of you I've dealt with with different programs and services, different issues across the wide geography of the South West LHIN, so it's really great to see everyone today. What I'd like to start off with is just get a feel for the audience of where people are from, what sector, what geography. So I'm going to ask a couple of questions, and if you can put up your hand, and then it gives me an idea, but also gives your fellow participants an idea as well in terms of where people are from. So why don't we start with geography? Who's here from Grey Bruce? Oh, good turnout. And here in Perth? Oh, great turnout. Oxford? Good. London Middlesex? Elgin? And how about Norfolk? Now, I knew the Crescent Care folks from Cortland were coming today as well, so that's great. Now, how about by sector? So long-term care. Okay. Community support services. Primary care, CHC, fits. Great. Hospital? Great. And CCAC? Strong table over there. And the last question I'll ask is the division between staff and board members. And Jamie Orlikoff and I were just talking about board representation here. So how many people are staff at a health service provider or a partner? And how about how many people are board members? So a good turnout of board members as well. So that's great. So again, welcome to our 2014 Quality Symposium. I'd first like to start by an introduction of our board, and we've got 7 board members here. Jeff Lowe, our board chair, he's coming later this morning, so he's not here at the present time, but if I could just ask our board members to stand up and give a wave. So we'll start with our vice chair, Ron Bolton. Ron's from St. Mary's. Jerry Moss is our board member from Port Elgin. Barbara West Bartley, I haven't seen Barbara yet this morning. Oh, hi Barbara. Aniko Varpalatai, who's right there, from Southwold Township in Elgin County, and Barbara's from Wyerton. Lori Van Opstel, and Lori's from Tilsonburg, one of our newest board members. And Wilf Riker. I don't see Wilf yet. Wilf is from Port Stanley. And Ron Lipset, our board member from Grey County and Annan, just outside Owen Sound, he's not here today. Unfortunately, his mother passed away 2 days ago, 98 years old, so had as he said, a long, full life. So our thoughts go out to Ron and his family. So just want to start things off. I think everyone's heard that there's a provincial election coming up. And with the dropping of the writ last week, it has created some challenges for us in advance of the Quality Symposium. During the election period, the ministry and government staff go into caretaker mode. So this means that they continue with existing programs and services, but there's no consultations, no announcements, no new programs and services announced. So with that, that caretaker mode also applies to the South West LHIN. So we had a decision to make last 2 Fridays ago and last Wednesday when the writ was dropped. We had a decision to determine whether we'd continue with today's event. And after some discussion, consultation, reflection, our board chair, Jeff Lowe, and I agreed that we would proceed with today's event. We strongly believe that the Quality Symposium, this event today, is about increasing the level of knowledge and understanding of staff and board of our health service providers, provides an opportunity for all of you to interact. I've talked to a number of people this morning about it's great to see people from so many different sectors and geography share ideas. And in the end, the Quality Symposium is about making the health system better. It's not about advancing the current government's agenda, definitely not about portraying any political leanings, and we don't want today's event to unduly influence the political process that's unfolding. So we're very happy that we made the decision to continue. We did have to shuffle the program a bit. Originally we had the minister was going to speak this morning. We also had CEO of Health Quality Ontario, Dr. Josh Tepper. He stepped away from the Quality Symposium based on what I said earlier about minimizing the number of appearances for government staff. So our program is a bit shorter today. We're going to be wrapping up about 4:10, but it gives an opportunity for our great list of guest speakers to have a bit more time and a bit more engagement with the audience here. So in the end, we've obviously made the decision to proceed with the Quality Symposium, and hopefully by the end of the day, you'll agree with us that it was the right decision. So what do we want to accomplish today? We're very pleased, as I said, to have a great lineup of presentations, all related to our title, which is Shaping the Future of Quality Healthcare. And we've got three objectives. We first want to increase your understanding and commitment to key quality strategies and initiatives. Secondly, we want to highlight the successes of the South West LHIN. And lastly, we hope to position our health service providers, all of you, to lead and support system-level change. And at the end of the day, we'll have our quality awards. So our quality awards is where we have the opportunity to recognize the great work that's been going on within the healthcare system, and with the recognition of that quality award, which Jeff Lowe, our board chair, will be presenting at the end of the day. Looking at the year in reflection, we've had a number of things that have gone on since the last Quality Symposium. Our health links, a number of our health links have advanced. Several are beginning to take shape. We've realigned resources around complex continuing care and rehabilitation beds to work towards system balance. We've undertaken considerable work with our adult day programs to define that core basket of services and create a standardized fee. We've worked with our health service providers to shift the way in which physiotherapy services are funded. We've implemented RIDS, our Regional Integrated Decision Support System, which is a great tool which hopefully more and more of you will begin to see the power of that and how we can take the data that exists within the system and use it to our advantage to make funding, planning, and system design decisions. The Oxford County Joint Services Plan was completed with a number of recommendations for moving forward. And then the last one that I'll recognize is that there was a review of the LHIN legislation. LHIN is the Local Health System Integration Act. The Ontario Legislature asked the Standing Committee on Social Policy to look at this legislation. It was a requirement when our legislation was first put into place. So it provided the committee, which is a multi-party committee of all political parties, to hear about what was happening within the system, to hear about the work of the LHINs, and look at identifying opportunities to strengthen and improve that legislation. The Standing Committee had public consultations in 9 communities across the province, London being one of them. And from these sessions, the committee heard from a number of stakeholders. They heard from community agencies, hospitals, physicians, CCACs, police chiefs, unions, members of the public. And although we have our critics, the LHIN system, the majority of those presentations, not just in London, but in all the other sites across the province, were very positive initiatives about what's happening within the healthcare system. So these presentations painted a picture for the committee that you may not always hear or see within the media, but we know that it exists and that all of you have the benefit of working in every day. And although the Standing Committee has stood down now, the committee did have the opportunity to hear that positive work that's going on across the system with both health service provider staff and governors. And governors are such an important part of the Ontario healthcare system. As you know, the province of Ontario is unique across Canada, that we're the last jurisdiction that still has local health service provider boards. And I just want to speak about the importance of these boards, because I frequently have people saying to me, Mike, just get rid of them. Get rid of the boards. They get in the way of the business. They hold us back from true transformation within the healthcare system. And I can tell you I don't agree with that. And I don't agree because I've had the opportunity of several instances where I've seen boards rise up to the occasion to actually influence system change and make things better for patients, clients, and residents. And the example that I've had over this past year is working with the amalgamation of the 3 community mental health organizations in the City of London. After 2 years of very challenging negotiations, discussions, debate, the 3 organizations, CMHA London Middlesex, Search, and Watch, amalgamated to become CMHA Middlesex. And I truly believe that the amalgamation of those 3 organizations would not have been possible without the involvement and leadership of the deal development team, which is made up of the boards of directors from those 3 organizations. And they did it because they focused on the client. They didn't focus on their own organization. To them, it didn't matter what the name was on the door. They wanted to make sure that they were improving things for the client. So they saw that an amalgamation would actually provide an enhancement in the variety of services, better navigation between services, and an improved coordination of services for our clients and their families. So I personally want to thank Eric Schlatzler, Elizabeth Abbott, and Sue Estabrooks, the 3 board chairs from those 3 organizations, for leading the deal development team. And I also need to recognize Claudia Moyer-Eckel, who's now chairing the CMHA Middlesex organization. And for any of you that are interested in this type of conversation, what transpired, some of the pitfalls we experienced, we're documenting this process, and that process is underway, so it'll be available for you to reference at some point in the future. But let me be clear that the success of health system transformation is not just in amalgamations or mergers. There's so many other ways where we can see success within the healthcare system. And a good example of that is the South West LHIN is taking a renewed focus on health equity. We're taking steps to ensure that all residents have access to the same quality of health care regardless of their socioeconomic or cultural background. A forward-looking vision of health equity is ensuring equal opportunities of good health for all. And it's been proven that people in less advantaged or less powerful situations, whether it's measured by gender, socioeconomic status, or social class, race, or immigration, tend to have poorer health. One great example that we've undertaken to ensure that we are advancing health equity within our system is the development of our Indigenous Cultural Competency Training, ICC. ICC is an award-winning practice for online cultural competency training, which provides learners with a foundation to understanding of Aboriginal culture and traditional practices, the impact that history has had on Aboriginal health, and the effect of personal biases. We've actually adopted this from BC, where that cultural competency training is a requirement of all health service providers. So again, this is a great example where we can take a practice that's been adopted in another jurisdiction and apply it here within the South West LHIN. I also want to talk about experience-based design. We've got a section of our program this morning, or this afternoon I should say, is talking about experience-based design. We're trying to incorporate the work and the vision, or the view, I guess, of patients, clients, and residents into our system design work. I had the opportunity, for those of you that were here last year, you would have met Ted Ball. Ted Ball is a former chief of staff for a number of ministers of health. He's a policy advisor. He seems to be everywhere within the healthcare system, writes a blog. But I had the opportunity to talk to Ted the other day, and he told me the story, because Ted always talks in stories, about the hotel manager. And he stated that if you were managing a hotel and you had the owners of that hotel coming to your hotel for a visit, what would you do? You'd want to make sure everything was perfect, that service was impeccable, the food was hot and tasty, that everything was in order for the owners when they came. And then Ted translated that into the healthcare system. In a publicly funded healthcare system, who are the owners of the hotel? It's the patients, clients, and residents. Who's the manager? It's us. So we have a big job to do. When we are in the healthcare system, we have the owners of the organization coming every single day, every single hour to your organization, into ours. So our work is really cut out for us to ensure we step up to the plate every single day to earn the satisfaction of that health system owner. Looking forward, there's a number of issues on the horizon that will influence what the healthcare system looks like going into 14, 15, and beyond. One is relating to how hospital services can be moved out into community-based specialty clinics. So these would be examples of that would be cataracts, endoscopy. Regulations have now been put in place which would allow cataracts and endoscopies to be done outside of the hospital setting or as a satellite of a hospital. And the regulations have actually changed that LHINs can now fund in independent health facilities, IHFs, which we never had the responsibility for before. So to make sure that we're making the right decisions about that, we put in place clinical services planning committees on cataracts, on endoscopy, to make sure we're making the right decision around whether they should move, and if they did, under what conditions. So before I wrap up, I wanted to make sure that I reflected on what we've heard from you about what you think a successful quality symposium looks like. We took your feedback from last year, and I just want to give this back to you to see that we've listened, hopefully listened, and you can tell us by the end of the day whether we've done a good job of taking into account your wishes. So feedback from last year, participants wish to hear more about the experience-based design and how it's working to improve care. So we've got a session on that today. Participants also wanted to make sure that we are more inclusive of all sectors, not just hospital-centric. And this is sitting in my chair, it's often a challenge for me because I'll hear from community providers that we spend too much time with hospitals. Hospital people tell me I spend too much time, or we spend too much time with community. So it is a balance, and hopefully today's Quality Symposium is a reflection of looking at all sectors across the system. People also ask for a more dynamic, inspirational feel, so they want to leave pumped up from today's session. So we've got great speakers today, and I know all of them are going to leave you feeling more informed and hopefully giving you some of that inspiration when you go back to your own shop. You also ask for practical advice, so we're going to give you more tools and takeaways. And you also ask for more breaks and networking opportunities. So we've incorporated a number of these networking opportunities into the session today to make sure that you have the opportunity to interact with people that not only in your own business, but within others. And I'd really encourage you to find out someone today that you don't know. Talk to them, ask them where they're from, why they're here, what's important, what's on their agenda, and then you'll be able to gain that knowledge when you go back to your own operations. So in closing, I want to thank each and every one of you for all the work that you do in making the lives of patients, clients, and residents better for the people that you serve. I personally want to thank some of our leaders that have stepped up to the plate for a number of committees and structures that have been put in place to advance health system transformation. Our Health System Leadership Council has just recently been revamped. We have new membership. We've had our second meeting now, and things are going along great. The Health System Leadership Council is providing us with advice and comment around our priorities for investment process. So we're getting their advice to make sure that we're making the right investment decisions. Our board is making the right investment decisions for the new funding that may come into the system. Our area provider tables, for all of you that participate in those area provider tables, they provide a great opportunity for us to connect and engage with each of you. And then some of our other committees like Quality Advisory Group and the Board-to-Board Reference Group. I know many of you in this room are on those committees, and they provide valuable input to all of us to make sure that we're moving forward. So I feel very optimistic that we're embarking on changes to the healthcare system that will truly put the patient, client, and resident at the center of the system.